Podcasting from Ehealth New South Wales. This is Let's Talk Ehealth.
Welcome to Let's Talk Ehealth, a podcast designed to showcase the projects and people we have at Ehealth New South Wales. Today we're talking about value-based healthcare and a program that enables our health system to keep patient outcomes and experience at its core. I'm Danielle Johnson, Delivery Manager, Cloud Services at Ehealth New South Wales. And today I'm joined by Mel Tinsley, Associate Director for the Integrated Digital Enablement Accelerator at the New South Wales Agency for Clinical Innovation. Welcome, Mel, and thank you so much for joining us today.
Yeah, thanks, Danny. It's great to be here.
So, Mel, to kick off, what is value-based healthcare?
Yeah, sure. So value-based healthcare is really about considering the health experiences and outcomes for our people, people being our patients, as well as making sure that we're able to deliver effective and efficient care across our New South Wales healthcare system. Really importantly, I think the focus is not just about cost reduction, but it really is about improving the outcomes and experiences for people with people. We know that value can be enhanced at various stages of the care pathway for a person, all the way from diagnosis to care delivery, and then also to follow-up. Historically, we used to measure value by volume and output rather than how we should in terms of clinicians' experiences of delivering care and patient outcomes and experiences. So what we've really done is we have changed the way that we talk about value. Key to value-based healthcare is the patient-reported measures program. So patient-reported measures capture information from people about their healthcare experiences and outcomes at the point of care through surveys. The surveys are collected and used through the Health Outcomes and Patient Experience platform across New South Wales Health. Our clinicians and healthcare services can then use those in real time to provide care that meets people's needs.
I see. So elaborating on that, Mel, why is this important to the system, value-based healthcare?
It's really important across our healthcare system, not only for the reasons that I've just mentioned, but also to ensure that we're supporting the New South Wales Health vision. And that vision is for a sustainable and personalised healthcare system that delivers outcomes that matter most to people and across our community as well. Really importantly, the move from volume to value is a critical part in achieving the vision. We know that if we are delivering value-based care, that it ensures the right care is provided in the right way, using the right resources, but really importantly, that it's aligned to people's preferences.
That certainly sounds very interesting, but also very rewarding, Mel. So I want to now turn to some of the work that you and the team have been doing in this space. Can you please tell us about the Patient-Reported Measures program and how it's supporting that shift towards value-based healthcare in New South Wales?
The Patient-Reported Measures program has been absolutely foundational in how we do this across the New South Wales healthcare system. So to deliver care that reflects what's important to people, we need to be able to understand directly from patients or their carers about what matters to them. The way in which we do this is through the collection and use of patient-reported outcomes and experience measures. So patient-reported measures are essentially feedback surveys in general terms. The feedback surveys ask a person to self-reflect and self-report about their experiences and outcomes. So the Patient-Reported Measures program provides those insight and the data to help us shift towards value-based healthcare. What we're really wanting to do is to make sure that patients are getting better experiences when they're receiving care, that it is centred around improving their quality of life. So really importantly, we're looking at all of the different factors. So looking at a person's mental health, social health, physical health, and their overall health.
That sounds really empowering and important that it's patients and carers collaborating together about their healthcare plans. So, Mel, how do we capture this patient feedback currently? And can you tell us a bit about the underlying technology that supports this program?
Yeah, absolutely, Danny. So patient-reported measures are enabled through a purpose-built IT platform called the Health Outcomes and Patient Experience platform, or as we like to shorten it to, HOPE. So the HOPE platform has been an enormous collaboration with Ehealth New South Wales, the Ministry of Health, our local health district and specialty health network clinicians and managers, but really importantly, with patients and carers at the centre. And we have co-designed the HOPE platform the whole way through. Co-design means that through every step of the process, we had our consumers and carers and our clinicians with us, really designing the workflows and the usability of the Hope platform to really make sure that it was person-centric as well. So it is truly custom built to fit all of our needs across the health system. As a couple of examples, Danny, for our clinicians, what the Hope platform does is that it provides real-time access to patient feedback through the clinician portal. So our clinicians can access it with single sign-on access across New South Wales Health, and the self-reported information by consumers is there for them through their electronic medical records. The reporting and dashboards help the clinicians to identify trends and prioritise care accordingly with their patients for their patients. If I move to what it means for our patients in terms of the Hope platform, it really gives patients the opportunity to share what they're experiencing and how they're feeling. Our consumers often tell us that through self-completing the patient-reported measures through the Hope platform, that it's giving them the permission, that it's giving them the words to express how they're feeling and what they're feeling so they can have truly meaningful and impactful conversations. I think the really amazing thing about the Hope platform is that our consumers have access to their data and also to self-management information.
That's fantastic, Mel. I know you've had some early success with this rollout. Can you tell us a bit more about some of the patients that have participated and some of the feedback they've had?
Yeah, sure. So as an example, one of our patients early on in the program was offered to complete patient-reported measures through their usual care. When this person was seeing their clinician for their follow-up post being admitted to hospital, they were invited to answer the surveys through the Hope platform about their symptom burden, but also their generic quality of life as well. In this particular instance, it was related to knee pain for osteoarthritis. What happened with this patient is that they were very happy to complete the surveys after discussing it with their clinician. They were then handed an iPad. On the iPad, the patient then went through a set of questions which they were able to self-reflect on in terms of, as I mentioned earlier, their overall health and how their knee pain may be impacting on that. Really importantly, the patient was able to answer a set of questions that were unique and specific for their osteoarthritis, so the clinician could see how the patient was trending over time and to really have informed conversations around potential alterations in their care plan. And so really empowering, again, the patient to have shared decision-making and shared conversations with their clinician and care teams. So it is focusing on really what matters to them. Whilst this patient could read and write and answer the surveys in English, I think the other important thing to note, Danny, and this has been really important through the patient-reported measures program, is that the Hope platform is available in the top 10 languages other than English. We know across our New South Wales healthcare system that we have a diverse society. So for us, it was really important that we could offer patient-reported measures, but also the accessibility of the Hope platform in languages other than English. What this has meant for our patients, but also our clinicians, is that if my preference is to speak Greek, as an example, and read and write and respond in Greek, that I can access the Hope platform in my preferred language. It empowers me to have a voice and to answer the surveys in my preferred language. And then my results are translated back into English for my clinician to view, and then we participate in that shared decision-making again.
Mel, that's fantastic that it's so accessible, I think, to people from diverse backgrounds and all different ages. It's great to hear that, but also that it's looking holistically at all the markers outside and taking a bit more of that preventative approach to healthcare. So as you've mentioned, it's all about elevating patient voice, isn't it, this program? So you've given us some examples, but can you elaborate a little bit more on how it's really helping the patients and clinicians at that individual level?
Absolutely. So at the individual level, and I'll keep with the same example, Danny, that I've used with our patient who has knee osteoarthritis and has had pain. What happens is that people are asked at various time points along their journey to self-complete patient-reported measures. If a person is unable to self-complete, their carer or someone on their behalf can self-report as well. So they answer the questions about their overall health, but then they also answer specific questions relevant to their condition. So for osteoarthritis, the patient will be asked questions around their pain and mobility, which are really good self-reported indicators about how a person's treatment and/or intervention is progressing. What happens in a clinic setting, in an outpatient setting, in a hospital setting, and this can also be done through virtual telehealth mechanisms. The clinicians and patients will then discuss the results. They will together identify where that person may need focused attention. They'll also identify any potential for early referrals to other services in a timely way. We know that timely interventions improve the overall outcomes and experiences of care because people are getting the care that they need when they need it, and also importantly, how they need it. The insights that clinicians and consumers are having through HOPE is data that we haven't had before across our New South Wales health system. So it's really empowering people to feel like they're being heard. Clinicians are therefore tailoring decisions around things that are important to individuals, but it's also saving our clinicians time. And because it is a statewide instance, if I'm accessing many different services across many different clinicians, my survey results are automatically available for people to see in real time as well.
So Mel, we've heard a lot from you about how patient-reported measures is benefiting individuals at the personal level, patients, clinicians. I want to just take a bit of a high-level view and a systems thinking approach. How is this initiative benefiting the entire New South Wales health system as a whole?
Yeah, it's a really good question. One of our core aims was to collect data once, use it for many purposes. We understand the burden that everyone faces every day. So through collecting self-reported information from our consumers about their outcomes and experiences that matter to them, not only was it really important to us that we could use that at the individual level to inform care, treatment and shared decision-making, but then we could also use that information at the service and system levels as well. So if I talk about it at our service level, our healthcare teams have real-time access to the reports and dashboards. They also have the ability to run their own reports about individuals or groups of patients. That's really important because it helps them to identify the outcomes of all of their patients. And if I use the example I gave earlier around osteoarthritis, for all of my patients who I'm treating, what are their outcomes as a whole? That information is really important because it does help to drive service improvement. As an example, one of our services identified previously that most of their people in their service were reporting high pain. That was information that they hadn't seen before. So as a result of that, what the service really focused on was discussing pain and options for people and how they could reduce their pain. And that has been done really successfully. So in reviewing their data, they have also noticed that the people reporting high pain has also dropped off. So it is a really important factor to consider that we can analyse the data for trends within patient populations. What that does for us at a New South Wales health level is to help celebrate what's working well, as well as improving the design and delivery of healthcare in New South Wales for that future. And it is around that sustainable healthcare system, but delivering high quality care as well.
So Mel, I want to turn to you as an individual leader in health. So you've been with the health system for over a couple of decades now. Reflecting on this work and your career, are there any personal highlights for you through PRM and HOPE?
There's been many highlights. A couple that I'll reflect on in particular. Patient-reported measures has really transformed the way we deliver care. It has changed the culture. It has changed the way that we measure value. It has changed the way that we put people at the centre. It has changed the way that we really value what matters most to people and then realigning care with people for people. So it has been absolutely transformative for those reasons. If I look at the enablers behind that, so what enabled that to happen? It really is about that one team approach. And I'm most proud of having that one team approach. Through that, it is the shared vision. It's a shared vision of many teams, diverse backgrounds across Ehealth, the Agency for Clinical Innovation, Ministry of Health, our districts and then our networks. But we all came together with one vision, one purpose, one outcome to be one team. And that is what I'm most proud of.
Mel, thank you so much for joining me today to talk about patient-reported measures and hope. This sounds like a very important program of work that's already achieving such benefits and impact to our patients and clinicians across the system. Congratulations on all of the work you've done. For our listeners, if you are interested in learning more about patient-reported measures and hope, please head to our website at ehealthnewsouthwales.com.au. You can also find the link in the podcast show notes.
Thanks for listening to Let's Talk Ehealth New South Wales. If you enjoyed the show and want to learn more, visit www.ehealth.nsw.gov.au.